Welcome to Science Force, where science comes alive.
Hello, everyone, and a very warm welcome to you all. I am absolutely thrilled to have you join me for today's highly visual explainer. Today, we're embarking on a fascinating medical detective story to uncover a condition that has literally puzzled humans for centuries. We're talking about the mystery of soft bones. This is a disease that quite literally shapes the human body, and we're going to do it by breaking down the science, step by step, together. Here is the roadmap for our journey today. First, the mystery of soft bones. Second, how healthy bones grow. Third, the vitamin D factory. Fourth, diagnosing the breakdown. And finally, treatment and prevention. Section 1. Mystery of soft bones. Okay, let's dive into this with Section 1, the mystery of soft bones. So, what exactly is rickets? Well, it's a metabolic bone disease found specifically in infants and children. It's characterized by the defective mineralization of growing bones and their growth plates, which for the medical students tuning in are known as epiphyseal plates. When these plates fail to mineralize, the newly formed bone just cannot harden properly, and the result? It leaves the child with soft, weak, and easily deformed bones. Moving right along to Section 2, how healthy bones grow. To really understand the crime scene, we first need to look at how the human body builds healthy bones. Think of it like pouring a concrete foundation. Children's long bones grow from those epiphyseal plates near the ends. Step 1, the cartilage cells multiply. Step 2, that cartilage enlarges. Step 3, and this is exactly where the concrete sets. Minerals like calcium and phosphate are deposited. Finally, the cartilage becomes hard, weight-bearing bone. But here's the catch. This process absolutely requires adequate calcium, phosphate, vitamin D, and healthy organs. If even one element is missing, the whole structural integrity collapses. Which brings us to Section 3, vitamin D factory. Now, for the life science students listening, this upcoming pathway is absolutely vital to memorize. Think of your body as a magnificent 3-step vitamin D factory. Step 1, it all starts in the skin. Ultraviolet B rays from sunlight strike your skin, converting a substance called 7-dehydrocholesterol into vitamin D3, or cholecalciferol. Step 2, this travels directly to the liver, where it's converted into 25-hydroxyvitamin D, also known as calcidiol. And by the way, this is the major circulating form we measure in blood tests. Step 3, the kidneys convert that calcidiol into the active hormone 1,25-dihydroxyvitamin D, or calcitriol. This active hormone is literally the master key that unlocks the doors in your intestines so you can absorb calcium. And this brilliantly illustrates what happens when the factory shuts down. It's a devastating cascade. If a vitamin D deficiency develops, the intestines absorb much less calcium and phosphate. Consequently, blood calcium levels drop. Panicking, the parathyroid glands release parathyroid hormone, or PTH. Now, PTH essentially cannibalizes the body. It steals calcium directly from the bones just to keep those blood levels stable. Deprived of minerals, the growth plates become horribly enlarged, disorganized, and the soft bones literally bend under the child's body weight. Section 4. Diagnosing breakdown. When these patients present in clinics, typically between 6 months and 3 years of age, the physical deformities are incredibly profound. We look for bow legs, clinically called genu varum, where the soft leg bones bend outward, or knock knees, known as genu valgum. On the skull, we might see frontal bossing, which is a very prominent forehead. Moving down to the chest, doctors will feel for the rachitic rosary. These are literal bead-like swellings at the rib junctions. You'll also see the Harrison groove, which is a visible depression where the diaphragm pulls inward on those softened ribs during breathing. Now, breaking down the clinical laboratory profile provides some incredible clues. vitamin D and phosphate are definitively decreased. Calcium, interestingly enough, might actually read as normal due to the body's frantic compensatory mechanisms. But look closely at the alkaline phosphatase, or ALP. It is markedly elevated. Why? Well, because the bone-building cells, the osteoblasts, are working overtime, trying frantically to mineralize the bone. Meanwhile, PTH is also elevated, desperately trying to keep that blood calcium stable. But the story becomes undeniably clear when you look at an X-ray. A radiologist looking at the wrists and knees of a child with rickets isn't going to see crisp, clean bone edges. Instead, the X-ray reveals widening, cupping, fraying, and splaying of the metaphyses. It looks almost exactly like the frayed end of a rope. You'll also see noticeably thin cortical bone and very poor overall mineralization. It is undeniable visual proof of the disease at work. Finally, we arrive at Section 5. Treatment and prevention. You know, the causes of rickets are surprisingly diverse. Nutritional deficiency is still the most common worldwide. In fact, a bit of history for you, during the Industrial Revolution, thick smog blocked out so much sunlight that rickets literally became an epidemic in city children. Today, it often stems from cultural clothing that limits sun exposure or exclusive breastfeeding without vitamin D supplementation. But it isn't just diet. Malabsorption disorders like celiac disease can block nutrient uptake entirely. And of course, chronic liver or kidney diseases can completely break that vitamin D factory we just talked about. So the crucial point here for our academic learners is understanding the strict difference between rickets and osteomalacia. Rickets only occurs in children because their epiphyseal growth plates are still open. That's what causes those prominent skeletal deformities. Once those plates close after adolescence, that exact same severe vitamin D deficiency causes osteomalacia instead. It affects mature bones in adults, causing a lot of weakness and pain, but importantly, without the massive structural growth deformities you see in childhood. Which brings us to our final, really provocative question. With sunshine literally free for everyone on Earth, why is rickets still a significant global threat today? It forces us to take a hard look at our modern indoor habits, our diets, our cultural practices. Simple preventative measures like safe sun exposure and proper supplementation aren't just polite medical advice. They are absolute daily necessities for the health of our next generation. Thank you so much for joining me on this explainer. Keep learning, keep questioning, and I will see you next time.
Thank you for watching Science Force.